is the best approach in terms of cavity preparation in a second-class cavity? For sure, in the past we had this approach of extension for prevention, but nowadays we want to have a prevention of extension. So in fact we are doing something like the carious lesion removal. We are doing something like the old restoration that we have to remove in order to have our clean cavity, and then in this case we can maintain the structure that we have. We can do other reasonings about what is the best solution, it may be to cover a clasp or to do something else. But what I want to talk in this video is about the finishing margin of our cavity in a direct approach, or anyway in an inlay cavity type. So for sure, what is important is to consider what kind of finishing line we have. In an example, in an MOD cavity, we have occlusal margin and a cervical margin. In the interproximal cervical margin, we can have a type of preparation, and in the occlusal, we don't want to have, in example, like in the past, a very large bevel in order to expose a lot of enamel, but nowadays we can try to have quite vertical preparation, like a butt joint with a slight inclination on the peripheral part if we want, and then that's it. This is more than enough. In the cervical interproximal area, we have to consider that the literature is talking about a lot of options. In example, we can have a concave preparation, we can have a bevel preparation, or we can have a flat horizontal butt joint preparation. In our clinical protocol as an aesthetic group, we are preferring usually to approach the most simply and repeatable preparation of the margin in this cervical area, and so usually we prefer to have a horizontal butt joint, both if we have enamel or dentin. It doesn't matter because we can treat and we can restore this margin in different way, but this may be the topic of another video. And so the fact that in this case we want just to regularize the margin, the cervical margin, we can use a specific burr that is working only on top and not on the on the other part of the working area of the burr, but just on the top of it, and then we can finalize without to take the risk to touch the neighbor tooth. For sure, it's very important to refine and to seal very well this area, because we have to prevent the secondary carious lesion that is one of the most important causes of our failure, of the failure of our restorations, and then we can go ahead with our restoration. So remember, in the occlusal you can do just a vertical preparation and refine this with a slight inclination. In the cervical area you can just do a butt joint horizontal line, and that's it. If you liked this video, please share it with your friends. Remember, do better than yesterday. See you in the next video. Ciao, ciao.